Welcome to Brain Wellness, the podcast. I'm your host, Mandi NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. Today, I am going back to our ABCs of concussion. So we are on letter C. If you've been following along, if you haven't listened to A and B, do go back because there are a lot of great topics on there. And then today, letter C, I have a lot again. So it's going to be another one of those more than 30-minute episodes because there's a lot of stuff to talk about in the letter C for concussion. You know, C starts with a concussion also, or concussion starts with C, I guess I should say. Before we get into today's show, I do again want to thank, I had some people take me up on my Black Friday offer of selling my book, Welcome Back, a TBI Recovery from Provider to Patient, at a discounted rate, signed copy. I mailed it directly, no shipping costs for you. And when this episode airs, I've decided I'm going to offer that again. So not for Black Friday, but just for the end of the year. So that will be another option to get the book at a discounted price off of what it is listed on Amazon and BarnesandNoble.com. And you'll get a personalized signed note from me shipped directly from me. So once this show comes out this Friday, we're recording it a few days before it comes out here, but when it comes out here this Friday, I will have that offer available through the end of the year. Just a little thank you for everybody who's been following my story and sharing about my story and just getting more word out there because I'm a little biased. It's my book, but it's a really good story to help other people understand what's going on in the brains of somebody that has a brain injury. And if you are one of those people that has a brain injury, just letting you know that you are not alone. So yes, I'm a little biased, but it is a really good story. And I would love to get it in your hands at a discounted rate, no shipping. And, you know, a little personal note for me. Why not? Kind of cool. So when the show comes out this Friday, you will have that other opportunity. Again, if you like what you hear on the show, you can always support me by buying me a virtual coffee. The Buy Me a Coffee link will be in the show notes as well. So that will be there. I will have a link to the discounted price on the book in the show notes. So that will also be there for you guys for your perusing pleasure once you're done listening to the show, or if you want to take a break and go take a look at it. So there it is. All right. So getting into today's episode, then the first letter C topic that I want to talk about is cognitive fatigue. And yes, I talked about this a bit when we talked about activity intolerance back in letter A, that whole conversation about mitochondrial energy deficiency. That's where the cognitive fatigue part comes in as well. Again, that mitochondrial energy deficiency, you're short on energy, that mitochondria cannot create energy because of the shift in the electrolytes when that brain injury happens. And then you hit your wall, as I talked about back in letter A. This cognitive fatigue, it is a mental exhaustion. It is brain drain. It occurs with even minor cognitive tasks. So what does this look like? It looks like slow processing speed. It looks like difficulty concentrating, which again, we'll talk about in a moment because that's another C word. It looks like trouble remembering things and just generally feeling like you are drained because that's what it feels like. This would also qualify for the whole brain fog conversation that we had in the letter B. So we've kind of talked about it a little bit a couple times now, A, B, and C. Now, as I was looking up information to include in this conversation, I found there was an NIH-cited study that looked at traffic-related mild TBI. Mild TBI, you'll see abbreviated as little m, the capitals TBI. So traffic-related accidents, people ended up with mild TBIs. 23% of those individuals in this particular study did not recover within a year, with the grand majority of their symptoms that were long-lasting being cognitive disruption, meaning that mild, quote, mild TBI wasn't so mild after all. So yes, it might be that the person wasn't in an ICU. They didn't have a head bleed, but they had these long-lasting cognitive issues, and that caused a significant disruption in their life. So not really mild when you think about it like that. That same NIH report identified that up to 50% of people can have long-term cognitive changes after a single TBI, with worse outcomes after recurrent injuries. And I know we've talked about this before on the show as well, that when people have recurrent concussions, recurrent TBIs, that lengthens the recovery time. It makes things more complicated for getting better. And here we see it again. Cognitive fatigue makes it very difficult to engage in social activities. As I've told people before, being around people sometimes is just too much. I saw a shirt one time that I want to get that it says, what did it say? Ew, it's two people out there or something. And ew, people, being around people can be too much for somebody that has a brain injury. It's too loud, too overstimulating. As I've said before to people, it's just too much of everything. It's very stimulating and it leads to cognitive fatigue because your brain just can't keep up with all of that. When you are stressed, it increases cognitive fatigue. Both emotional and physical stress will do that. Your body does not differentiate which one it is, but stress in general will make that cognitive fatigue worse. How do you manage cognitive fatigue? Typically, the things that they tell you to do are rest, pace yourself, go through cognitive rehab. This is usually done with a speech therapist, which was, again, something that I had to relearn all over again, which therapy works on this. Cognitive rehab typically is done with a speech therapist because they work on your language and linguistic abilities. Stress management therapy works well to try to decrease this cognitive fatigue, again, because if you have increased stress, it's going to increase your cognitive fatigue. Different treatments that are available. Again, it's because of the mitochondria not functioning appropriately that you have all this cognitive fatigue. So treating the mitochondria and trying to help the mitochondria heal and then your body heal after that. So things like what I have been doing, red light therapy, transcranial laser, neurofeedback. A new thing that I'm learning about is TMS, transcranial magnetic stimulation. That's going to be another topic coming up at some point once I can nail down a date with the provider that I'm trying to get on the show here, but definitely another topic that I'm going to be talking about because these things are helpful for the cognitive fatigue. They're helpful for multiple different issues that come up because of concussion. The next C topic is concentration. Again, another really big one. Part of cognitive fatigue is that difficulty concentrating. And again, as I talked about back in the letter A episode, sometimes it feels like, and sometimes it actually does get diagnosed as ADHD following a concussion or TBI. There was a research article that I looked at out of the Mayo Clinic. One of their fellows had done a research article on the fact that ADHD has a higher incidence rate after a concussion than it does for people that have never had a concussion. Because of the changes in the structure in your brain, the changes in your hormones, changes in how your brain functions. It's very difficult to be able to concentrate, especially when other things are happening around you. So that concentration becomes very difficult just in general, especially the more things that are happening. I personally redid my neuropsychological testing recently, and the psychologist that I met with who did my exam said that I did adequate, quote, adequate in a quiet environment without any distractions, but she supposed that I would not do as well in a work environment where other things were happening. And I can definitely attest to that, validate it, whatever you want to call it, because when there are more things happening, I absolutely have more trouble concentrating and more trouble trying to function. If I have to read something at work or in a clinic, such as a document that I have to sign or something that I have to prepare for a client that's coming in, if I have something that I have to read and sign, whatever, it's very difficult to do that if there are other conversations happening around me at the same time. I will need to walk away from the area, be in a quiet environment so I can read it and actually understand what's happening in this thing that I'm reading in order to sign it appropriately. So I know what I'm signing even. Multitasking goes out the window when you can't concentrate. And I have said before on this show that tasking alone has become difficult at times for me. So the multitasking part really essentially becomes non-existent because you just can't do multiple things at one time. The concentration that's required to focus on one particular activity is very difficult. And then when you add multiples onto it, it just doesn't happen anymore. Strategies that you can try to help with concentration to work on this can include things like using reminders for yourself, working in a quiet space, reading out loud, practicing meditation and mindfulness is also always really good. Again, it's part of that decreasing stress part of things. And I will agree to some of these. So setting reminders is an absolute must. That's something that I have had to do quite a bit in my recovery process. Not so much even for the concentration part as just the memory part, though, because I can't remember to continue on with my laundry, for example, if I don't set myself a reminder to go over and switch the laundry over from the washer to the dryer, take it out of the dryer, yada, yada. Yes, I know some people that will say that they struggle with this all the time and this is how they live their lives, but this is literally something that I deal with all the time now, and it is something that I didn't have to deal with prior to my accident. So this is a change. It's not something that I've done all my life that I've just had to get used to. This is a change for me. And again, setting those reminders for me isn't so much concentrating because I don't really need to concentrate to do the laundry. But if I am doing something else, I'm going to forget that I was even working on it. There's that little ADHD piece. As far as working in quiet spaces, that actually can be helpful, as I mentioned. But as a parent, I'm going to ask any of you that are out there, have you ever found a quiet space in your home where you're a parent, then you can actually work on things? And then if you are always having to leave everybody else, do you actually feel like you're present with your family then? Especially if it's just something where maybe you could multitask before and read papers while everybody else is doing stuff around you, and now you can't. Um, for one, my children still come and talk to me through the bathroom door, so there's no quiet even in the bathroom for me at home. So finding that quiet space to really focus on things can sometimes be a bit difficult. That quiet space is not always available, and if you're trying to work, if you're working from home at two and there are other people in the house, it's difficult to try to focus on that. But if you're working outside the home, you can't always be alone at work. There will always be some sort of distraction. So you have to work around that and try to learn to do things even with distractions in place. Reading out loud, one of those other top ideas, has helped me to some extent, except the fact that I still struggle with comprehension of what I'm reading. So the concentration part doesn't help so much if you're not comprehending what you're reading. So reading out loud can be more helpful in that regard to keep your concentration, to keep your focus on what you're reading, but you have to be able to comprehend what you're reading to make it fully effective. And one thing that I don't quite get across when you guys see me on these podcast interviews, or if you listen to the interview, you're not getting the point that when I do this podcast by myself right now, if you're watching the video on this, you're going to see me looking down a lot because I have my notes written out very detailed so that I don't forget what I want to say. When I have a guest on, I have a set list of questions that I ask everyone. There's just a few questions. It's not a lot. So if you've listened to the show enough times, you've kind of caught on to some of those questions that I ask everybody. And then the rest of the questions come from the conversation. Sometimes the person coming on, the guest, gives me some ideas on questions that they want to be asked. So I will add those into it. But if I don't have that question list, and if I'm not taking notes on something as they talk, I will, and I have forgotten where we are in the conversation and forgotten the next question that I wanted to ask. So there are times when I have to edit out those big breaks because I lose track of my thought. I lose track of what we were talking about. I had a question in my head that I wanted to ask, but I didn't write it down, and the question goes away. So sometimes I edit that out. I have left it in there recently just so you can see or hear some of the struggles that I sometimes have. That said, even text messages are sometimes difficult for me if they are more than a couple of sentences long. And I am in a group text with my sisters, and I will admit that some of those text messages get to be a bit long. And once you have to scroll, don't ask me to respond to you right away or to try to comprehend everything that was said in that message, because it's just not going to happen. So again, if it's more than a couple sentences long, it's going to be more difficult for me to wrap my brain around that. My brain goes off into la la land as I'm trying to read it. So reading out loud might help me a little bit with that, but it is not going to be the end all be all answer to that particular problem. And for me personally, it has been a struggle to really find something that significantly helps any of these symptoms and makes me feel human again. And I know I'm not the only person that feels like that. So just having you guys understand where that's coming from is a big win for me. The next topic along those lines then is comprehension. I kind of alluded to it a little bit already. Comprehension is, or difficulty with comprehension, I should say, is when you struggle to understand either spoken or written language. You have difficulty following conversations, interpreting complex information, and reading comprehension is a difficult thing to do as well. So it, again, can be difficulty just understanding the meaning of the words, following the flow of the conversation, or interpreting subtle cues given by other people. Sometimes you really have to just be blunt and tell me what you want to say or what you want me to hear, because if you're being subtle about it, I'm probably not going to catch those little subtle cues anymore. What else can this look like? It can look like needing extra time to understand what someone is saying or misinterpreting instructions or questions. So if I'm not doing what you expected me to do after we had a conversation, maybe I didn't interpret what you said correctly and I'm not on that same page as you are. It can look like difficulty following storylines in movies or books, which is why I'm not able to do one of my favorite pastimes in reading because I cannot follow that storyline very well. It can be feeling overwhelmed by complex conversations when big things are happening in conversations or multiple conversations are happening at the same time. We're in the holiday season, there are families getting together, and nobody ever talks about the same thing all the time. Everybody's talking across the table about multiple things. And when those multiple things are going on, it's really difficult for me to follow any one of those conversations. And again, I know I'm not alone on that one. And then again, struggling to read and comprehend written text, whether it's text message, book, or otherwise. There are things that are a little bit more severe, even than just regular comprehension. More severe language disorders present as things like aphasia. I used to talk about this all the time when I was working with stroke patients. Aphasia will affect your speech production, or you will have difficulty understanding spoken language. So again, when you hear those words, they just don't make sense because your brain is not interpreting them correctly, or you can't come up with your words because you have word finding difficulty. Some strategies to help with comprehension. Some of these are going to come directly from my therapist that I have worked with. So some of it is in the research out there to show that what's beneficial. Some of the first things are covering up the words that you aren't reading. So if you're reading a book, having some kind of line guide or even just a piece of paper across the words that you're not reading. So you're just reading those words at a time and you're not getting overwhelmed by everything that's on that page. Because if there's just too much there, that overwhelm can also shut down your comprehension. Take breaks after reading for 15 minutes if you can get to those 15 minutes, but definitely take some breaks because you need your brain to be able to keep functioning. And if you work it beyond the level of function, then it's going to be more difficult to try to comprehend. It's not going to get easier the more you try to force yourself. Speech therapy appointments obviously are going to be helpful. That's where you're going to learn some of these techniques. And one of the things that my speech therapist, I had a couple different ones throughout the time that as we worked on, told me to read that same line over and over a few times until I can say it back what I read and then move on. Or as I'm going through a paragraph, see what I can comprehend, and I don't move forward until I can comprehend and I can understand what's in that paragraph. Once I do, then I can move forward. I guarantee you that takes me more than 15 minutes. So my reading sessions are very short these days. I don't sit and read an entire book cover to cover like I may or may not have done in the past. Other recommendations for strategies are slowing down and taking your time when reading. Try not to just rush through it. It's not speed reading at this point. You're just trying to read to comprehend. And especially important if you have important conversations with people. This was a recommendation from my speech therapist also. Take notes on those conversations and read back the notes at the end of that conversation, whether it's a conversation with a family member or somebody at work. Take notes on that conversation, read it back to make sure that you have understood things correctly in that conversation. You know those action plans that need to happen moving forward for those important conversations so that you're not missing something that will help with that conversation bit. The next topic is convergence insufficiency. So a little bit change in pace. This one is talking about our vision. In convergence insufficiency is where it's a condition where your eyes cannot converge appropriately when you're looking at an object to create one significant solid object. So when we look at things, we have two eyes to look at our thing, at everything. Both of our eyes send information back to the back part of our brain independently. And within there, those objects have to converge to create one object. When we're looking at a computer screen, for example, we're not looking at two computer screens. We're looking at one. Whatever's happening on that screen is all one object. So when we're looking at that, our brain has to take that information, bringing from both eyes, create that into one object on the back of the brain, flip it upside down. There's some other fancy things that are going on there as well. But it needs to create that one object so that our brain can identify what it is that we're looking at. Same thing if we're looking at a pen or a cup or whatever is in front of us. We're looking at that and we have to create one image from that. When it's not working appropriately, you get kind of this blurred vision. There are some images online where you can see the different levels and severity of double vision or convergence insufficiency is what it looks like. In all the way from actual double vision, where you have two objects that you're looking at because each eye individually is sending information to the brain and it's not converging at all. It's not making that one. Or things can just be blurry because those two objects are not distinctly clear, but they're also not distinctly blurry. That's where I was when I went to my eye doctor for the first time after the accident, is I couldn't tell him that I saw double clearly. It was not clearly one object. It was not clearly two objects until we did some of the testing. And then it's like, oh, yes, I do have double vision. That's what that is. And it was from this convergence insufficiency. So symptoms of it can be either double or the blurred vision, because it can be anywhere in that scheme of things there. Eye strain or fatigue, because you're working so hard to try to create that single object. Headaches, again, from the fatigue and the stress of trying to create that single object that you're seeing. It can look like difficulty reading and concentrating because you're not able to form that single object of the words in front of you. So it can look like difficulty concentrating on the words or difficulty understanding the words, but it's because of the visual difficulties related to it. It can also look like words or letters are moving when you are reading across a line. And I actually did some testing with my first vision therapist that I worked with. And when we were working on things, she would have me look through this list of letters and I had to read them as quickly as I could. So comprehension, how quickly are you comprehending those letters? And it had streaks of either letters or numbers that I had to read them off. And at one point I stopped and I asked her point blank, I said, are these actually in a straight line? Because they didn't look like they were. They looked like they were wavy lines across the piece of paper. So it can look like those words are moving. It can look like they're not in a straight line, even though they are, just because your eyes are not working appropriately. It can also look like a frequent loss of place. So you're losing your place when you're reading because those things look like they're moving and they're not going to your brain like they're supposed to be. How do you treat convergence insufficiency? And this is one of those topics too, that it's not specific to concussion. You can see this after a concussion, but you can also see it after other things as well. It can be a problem all on its own. So these treatment options would work for anybody with this convergence insufficiency, not just because of concussion TBI. So things to work on it would include convergence exercises. Again, this is going to be working with an occupational therapist because they are the ones that work on the vision therapy. So OT vision therapy, not just any occupational therapist, has to be one that works specifically on vision. Exercises that they will give to you might include things like something called a Brock string, and that's literally a string that has a few different colored beads on them. And what you're doing is holding the end of the string and the other end of it is on the wall with these beads on it at various distances. And what you're trying to do is converge, and you're looking at the bead closest to you and then working your way to the other beads and working your way back and trying to, you should be seeing the the string double. So it should be kind of like an X with two strings going to the bead, two strings coming out the other side. And then you're working on trying to see the beads at the different lengths. And now another thing that I get to do with that Brock string is trying to see things in my periphery, because my peripheral vision shuts off when I'm trying to focus on something too. So there's a whole nother layer to this. There's so much more with vision that we'll talk about probably down that V letter, but focusing on the convergence and sufficiency right now, the Brock string. And then there are some different sheets that have images next to each other, that the images that are next to each other are partial images. And when you try to make your eyes converge and turn that into one image, you get a full image once both of those things have gone together. So like one of them, for example, is a stop sign. So I have the outline of the stop sign and the word stop is on the image next to it. And then when you are working with your eyes, you're trying to create them both together so that they overlap each other and you have a full stop sign. Other things that can work for this, working very closely with a neuro-optometrist, because they are going to communicate with your OT vision therapist, and they can also prescribe prism glasses, whether it be horizontal or vertical prisms, to try to correct your convergence issues. And then sometimes you have convergence at different distances. So my convergence close up now has gotten really good because of therapy, but my distance convergence is still awful. So there's that. So now we're working on different kinds of exercises around these things to try to get that distance convergence there. Year and a half in, and I'm still struggling. So for any of you who are just starting out, just know that you are in this for the long haul. The next topic is a little bit more in depth. So I'm going to kind of intermingle some of these really deep topics with the maybe less deep topics a little bit as we go through here. I did not put them in any particular order as we were going along, other than just this is the next topic. So next topic, no real good segue here, is chronic traumatic encephalopathy. You will see this abbreviated CTE. CTE is a rare degenerative brain disease. As far as we know, it's still rare. That is a result of repeated head injuries. And when I say repeated, it's not just one or two little injuries, it's multiple head injuries. It tends to be more with people who have repeated contact sports injuries, but it can be with other injuries as well. But most often with repeated head injuries from these contact sports. The symptoms of it are going to sound really, really familiar, because there are things that we've talked about on just about every episode of concussion related topics on this show so far. It looks like memory loss, confusion, depression, aggression, trouble sleeping, anxiety. It can also cause behavioral problems such as mood changes and problems with thinking. It often presents in your late 20s or early 30s, or again later around age 60. I did see when I was looking this up, though, that the youngest person ever to be kind of diagnosed with it is age 17. But again, typically it happens later, either in your late 20s, early 30s, or again around age 60 is kind of the two peaks in age diagnoses. Risk factors for this include the contact sports, the big one, things like football and boxing, things where people get repeated head injuries time after time after time again. I had a patient one time who said that he was he led the wedge in their defensive move. So he was in the front of this wedge, and he would constantly get multiple head injuries every game that they had for years. And then he came to me with neurological problems later on, actually concerned for a stroke. So it was not a stroke at that time. It was other things that were looking like a stroke, but it definitely causes some long-term impact on people. There is some talk about whether or not age of the first exposure to head impacts has any impact on it. No pun intended there. But definitely the number of years of exposure, the number of repeated head injuries definitely plays a role. So the more times you hit your head, the more likely you are to have a risk for this. There is also a question of some genetic risk, but again, that's not clear. So The only true risk factors that we know about are the multiple head injuries from those contact sports, most often being football and boxing. And the difficult thing with this is that it's mostly a clinical diagnosis. So we look at these symptoms and a person's history, and we can say that, yes, it looks like CTE, but it can't be seen directly on imaging such as CT or MRI. There's nothing that's going to show up to say, yes, this is what it is. It can only be fully diagnosed on autopsy, similar to like an Alzheimer's type of thing, where we can visualize an abnormal tau protein in the blood vessels of the deceased. So that's the only time we can truly diagnose CTE. Unfortunately, we can suspect it while somebody is living, and then treatment is based on symptoms. There's no known cure for it. The best protection is prevention, which is why so many things have changed in the world of sports. We have helmets now that can identify when somebody's had an impact. We do the heads-up concussion impact testing. We do things like keeping people out of sports until their symptoms have returned. I know that seems like a really controversial topic sometimes still, and it shouldn't be, because if people truly understood the long-term consequences, they might be less likely to jump right back into that sport. Who knows? Um, there are some complications with it, or potential complications. It can lead to things like dementia, Parkinson's disease, movement disorders, similar to ALS, also known as Lou Gehrig's disease. All these things can happen because of the changes in the brain that happen because of the diagnosis itself. So again, something to think about with all those multiple head injuries. But again, as far as we know, it is still a rare diagnosis, a rare disease at this time. The next topic I want to take some time to talk about is caregivers. And this probably could be an episode all by itself. My husband and I have talked about it. He's come onto the show to talk about it twice now. We talked about it a year ago, and then not that long ago, he came back on for a little update on how our relationship has changed. Because as a caregiver for me for the last year and a half, he's had to take on more things in his own stress load to make sure that our house continues to run as it should. For the caregivers, they can experience things like emotional stress, burnout, anxiety, depression, difficulty coping with behavior changes of their loved ones, frustration due to the person's cognitive limitations, and lack of understanding of the recovery process. And that's one thing that my husband and I talked about initially when he was first on the show, is that he didn't understand what was going on at first, that he still has days where he doesn't quite understand, but he's definitely trying to educate himself so that he can be a better partner in this, as well as caregiver. And so for those of you that might not know what the symptoms of stress are, although everybody has stress, so I'm going to say if you don't know the symptoms of stress at this point, you're probably living under a rock and in denial or something. I don't know. But so the symptoms of stress to watch out for in caregivers especially, but you could see this anywhere, is neck and shoulder tightness, muscle tension, depending on where you hold your tension, stomach upset and nausea, constant aches and pains, headaches, weight changes, sleep issues or fatigue, forgetfulness, difficulty with concentration, trouble making decisions, feelings of hopelessness, isolation, guilt, worthlessness, constant sadness, and feeling blue are probably more obvious ones. Fear, worry, anxiety, crying spells, viewing problems as overwhelming, loss of interest in activities, hobbies, or sex. If any of those sound familiar to you, you're probably stressed out. And also, again, if any of them sound familiar, they also sound like symptoms of concussion. So if you were in the car with the person that has a concussion from a car accident, there's a good chance that you have a mild traumatic brain injury yourself, concussion yourself, because you have all of these things. And then if you are still the caregiver for the other person who was more severely affected, you have the stress of the caregiving on top of all of that. So that's a lot to try to deal with. It is very hard on caregivers to watch their loved ones, their person's struggles. It can be physically exhausting, whether or not the person needs physical assistance. It could be physical assistance to the person. It can be physical assistance because of increased workload on the caregiver. They're just taking on more physical responsibilities around the house, or maybe they've taken on a second job to cover finances. It can be very physically exhausting for those reasons. It can also be very isolating for the caregiver because other people outside your household don't understand. The caregiver isn't able to leave the house as much because they have to do more responsibilities, or maybe they feel like they can't leave the house as much because they feel guilty for taking time out, even if they are given the okay on this. My husband recently was invited to go to a hockey game with one of his buddies, and he felt guilty because that left me shuffling the kids around for last minute things that we didn't even realize that we're going to be there until after his event was scheduled. But I tried to help him understand that he needed to not feel guilty about that because he's been doing so much for me and for our family for the last year and a half that he was well overdue for taking a night out to just be a guy, be one of the guys. So there's a lot of guilt in that where the caregiver feels like they have to continue doing things. Changes in the person's behavior can put strain on the relationship. We've talked about that also when he came on the show, and on how my own behavior changes did put strain on our relationship. Financial difficulties put a strain on the relationship because if the person cannot get back to work, then that leads to a lot of financial difficulties for the household. And then caregivers are often so busy caring for others, for the person that they're taking care of, that they don't pay attention to their own physical and emotional health and well-being. So there's a lot that goes into that because that caregiver is always caring for that other person and not taking the time to care for yourself. In this sense, it's kind of like that old saying about when you're on an airplane and if the oxygen masks come down, you need to put the oxygen mask on yourself before you can put it on somebody else. Because if you don't take that time to put the oxygen on yourself and you pass out, then you're not going to be able to help anybody around you either. So you have to take that time, get your own oxygen on before you try to care for somebody else, because you need to do that. It's just a necessity. So how can caregivers try to manage this? There are support groups just for caregivers, just like there are support groups for the individuals that have the head injury. And maybe a support group is for you, maybe it's not for you. If not, I would highly encourage you to find somebody that you can talk to, though. Even if it's just another spouse of somebody else that you know that has a TBI, or somebody else that you've met that has a TBI, even if you're not going to a group, but you have that one other person that you can connect with, because they're going to be the most understanding of anybody that you're going to know, because they're going to be in a similar situation and you guys can both help each other. Prioritize your self-care. Because you're not so good at taking care of yourself as the caregiver, you need to prioritize your self-care. So get the sleep that you need, eat well, find time to relax. All of those things are necessary. Just like the oxygen mask, you need to take care of yourself before you can take care of anybody else. Educate yourself as the caregiver on concussion recovery. Try to attend any medical appointments with your person if you can, so that you can understand what exactly is going on. The more information that you have, the better caregiver that you are going to be. Communicate openly about concerns and responsibilities. Communication goes a long way in a relationship anyway, but when you have the stress of being the caregiver for your loved one also, you do need to make sure that that communication line is open so that you can talk about concerns and responsibilities, so that you are both on the same page and you don't have all of those frustrations building up inside that you're trying to keep off of the other person's stress level. And if these things don't help, know that there is professional help that you can seek as well if this all seems like too much. You as the caregiver might need some therapy and or medications to cope with the stress of dealing with this yourself, because it is a very stressful process trying to take care of somebody that has a brain injury, regardless of how much physical support that person needs. And then even though you're educating yourself and you're trying to get to know all these things, it is still very important to remember that every concussion is different. Not everybody recovers the same. It is not a linear process. You cannot compare one person's recovery with your spouse's recovery and say, well, that person got better so much faster. Why isn't my spouse getting better? And then try to make comparisons there, because as I've heard many times in different meetings I've been on lately, once you've seen one concussion, you've seen one concussion. That does not mean that you know how everybody else is going to react. No two people are the same, unfortunately. I knew that as a provider. I definitely know that now as the patient as well. As a caregiver, it's also important for you to advocate for your loved one. That's again where it's really helpful for you to go to those medical appointments if you can, so that you can bring up questions that the person might forget to bring up, or you can remember things that the care providers say when you go to those appointments, because the TBI patient themselves probably won't remember everything that happened in that appointment. And again, take breaks when needed. The next topics I actually put together, clumsiness and coordination. I had them as two separate things at first, and I'm like, wait a minute, they're kind of one and the same. So we're going to put them together here. So clumsiness, just clumsy or awkward movements. When you have a concussion or TBI, it can lead to troubles with your balance, with dizziness. Things can happen because of changes in your reflexes, changes in sensation or strength. Any of those can cause this clumsiness or coordination difficulty. What can it look like? It can look like dropping things easily, messy handwriting because you can't hold things really well with your hand. So even that fine motor coordination can be affected. Difficulty applying makeup or doing your hair, difficulty tying your shoes, difficulty organizing things, like physically organizing things, trying to get things in nice order, lining things up nicely. This is not the organizing that takes your concentration and trying to think about where you're going to put something, but it's the physically putting something somewhere, because maybe you're dropping things, maybe you're not holding things quite as well as you did before. It can affect your dexterity when doing manual work or playing sports as well. So I noticed this when I was doing archery. My dexterity with working my bow is definitely different than it was prior to shooting. Any of that kind of thing is definitely affected with my hand-eye coordination, because it's just not there right now. Even though I technically graduated from physical therapy, I got back to like 80% of what I was. The rest of it I'm still working on. Coordination and balance issues can be complicated by visual problems also. So like the convergence and sufficiency that we talked about can be complicating the coordination issues, because you can't focus to see things clearly. And if you can't see things clearly, you can't move clearly around in the world and in your environment. Testing that we can do to identify this when you come in to see a provider, we'll have you do things like rapid alternating hand movements. That can look like when you lay your hands down on your lap and you flip them over, so you can turn your hands over and under, so your palms are facing up and down and up and down and up and down, seeing how quickly you can do that. Finger to nose test as well. So we'll have you touch your nose, reach out and touch the provider's finger, and go back and forth with both hands to look at that coordination. And on neuropsych testing, part of that was coordination testing as well. And they have this little block with pegs and little metal pegs you had to put in one at a time and line them up. And they're, again, doing both hands to see how your coordination may have been affected by your concussion or TBI from that. How do we treat these things? Physical therapy is probably one of the biggest, most well-known things that we do to work on balance and coordination. Vestibular rehab specifically will work on balance. Light aerobic exercise for everyone. So again, as I talked about previously, 24 to 48 hours without doing a lot of activity is great for that early recovery, but you do need to get back into some kind of light aerobic exercise. Walking is fantastic. You don't want to jump into like a HIIT type of workout, but that light aerobic exercise, walking as tolerated, being safe with that. Other things that you can do are things like what we have offered at the clinic that I work at right now, exercise with oxygen therapy. We call it EWOT. When you're on a bike and you're exercising with oxygen, high concentration oxygen. Also, hyperbaric chamber. So hyperbaric oxygen therapy, HBOT, is going to be similar to the EWOT. It just takes longer to get there, and you're not actively forcing the oxygen into your body. You're passively getting the oxygen into your body, but that can be helpful for improving the coordination issues and getting you back into exercise. And it can help with so many things with brain rehab anyway, but definitely helps with coordination. And then physically resting when you're overstimulated. The more you try to push past that point of no return or hitting that wall, the more your symptoms are going to act up and be more severe. So rest when you're overstimulated, rest your brain, take that time to recuperate, recover before trying to move forward with other activities. And then the last topic that I have for our letter C is coma. So this is one for a long time. People were always afraid to have somebody go to sleep after they had a head injury or concussion because they were worried that person was going to slip into a coma while they're sleeping. And slipping into a coma is actually not a common risk after a concussion. All the things I was looking at in the research, it's not actually something that commonly happens, and actually only about 10% of people with concussion will even lose consciousness of any kind. So it's not a great number of people who do actually lose consciousness at any point. When you're looking at the research, sometimes they do use unconscious and coma interchangeably, but there is some difference between the two. There was a working group, an international working group put together of the Neurotraumatology Committee of the World Federation of Neurological Surgeons. Try to say that 5 times fast. It was difficult for me enough to say it once, but that international working group defined coma as a patient who does not follow commands and does not open their eyes either spontaneously or in response to noxious stimuli. So they felt they needed to have one definition of coma when they're looking at the research with this. So this was the definition that this international working group came up with. So not following commands and not opening their eyes either spontaneously or in response to noxious stimuli. When we assess patients in the hospital, we look at whether or not they can open their eyes spontaneously to us, and then we do painful stimulation to try to see if we can get them. We call it noxious stimuli, painful stimuli. It can be squeezing the nail beds or something. It's not something that's going to cause significant long-term damage, but something that is annoying enough that it should wake somebody up if they are just in a state where they are choosing to not wake up or they're not actually unconscious. But somebody who would be in a coma would not respond to even that noxious stimuli. The bigger concern with letting someone fall asleep after a concussion is not so much, again, them falling into a coma, it's missing signs of a serious brain injury, serious brain damage, such as a seizure or weakness on one side of the body, such as what happens when somebody has a bleed into their brain. So before you let somebody go to sleep, take a nap after a head injury, it is important that they get evaluated. And part of that evaluation is doing imaging on the head to make sure that there's no bleed. So we're not missing that big thing that could be happening if they're falling asleep. Otherwise, we do want people to sleep because sleep is when your brain heals. When somebody does land in a coma after a head injury, if they've been in a coma for greater than 24 hours, their mortality increases somewhere between 30 to 50%. So it's a huge increase in mortality if they do fall into a coma after a head injury. But again, it's going to be a small proportion of people that has that happen. The patients that end up in coma more likely are associated with the severe head injuries that also involve bleeding into and or around the brain. The bleeding and trauma that happens cause edema and swelling on the brain. That increases the intracranial pressure and can cause significant brain damage. That's why that mortality goes up, because of the increase in the pressure. Some of these patients might require surgery, such as a decompressive hemicraniectomy, big word for we take off part of that bone so that the brain can swell without being under the constraints of the pressure inside of the skull. And then once the brain has healed, we put that bone flap back in place. I have seen people get back to their normal state of health after a bleed when they've had a decompressive hemicraniectomy, because we have allowed their brain to swell and to recover from that injury. So that is my letter C, a very comprehensive topic, another C word there. So lots of words to think about there. And again, why am I doing this? It is because if you are one of those people that has symptoms lingering after a concussion, this will help you identify that those probably were concussion symptoms. There was a research article that one of my colleagues posted recently on, I want to say it was LinkedIn, that they looked at young athletes who had concussion, and the rates of athletes in concussion having concussion is only like 10 to 20%. But when you ask the students versus what was actually reported, their self-report goes up. But when you ask them if they had any of the symptoms, so rather than asking, did you have a concussion, they were asked about symptoms. It was like well over 50% of these students who actually had concussion symptoms. They just didn't realize that it was a concussion. So why I bring this information to you week after week with this ABCs of concussion is because if you are that person that has these symptoms, maybe as I go through these, you might understand that you have these symptoms because of a previous head injury that you had. Maybe it was recent, maybe it was more chronic. Either way, you could still potentially get some treatment for it now and improve those symptoms regardless of when the concussion happened. If you are a provider and you have a patient come into you with some of these symptoms and you're trying to figure out what it's from, maybe it's from concussion. I have seen so many people recently who have had injuries that probably led to a concussion. They weren't evaluated, or they were, and somebody said it wasn't a big deal. They just had a little concussion. They needed to rest a couple days and they would get over it. And here they are months, years later, still having symptoms because they weren't appropriately diagnosed and they didn't get the treatment that they needed. So my request to you as a provider is to take note of these symptoms as we go through these ABCs and see if these are things that show up in the patients that present to you with odd symptoms so that they can be diagnosed appropriately and get treated appropriately for their concussion or TBI. So multiple reasons that I share this information, not just for my own fun sake of my own personal, but this is to help other people. So again, if this can help one person, I'm great with that. And probably about a month or so, you'll hear the next installation of the ABCs with the letter D. If you have other topics that you think I should include from D moving forward in the alphabet, please do send me a message. I would love to hear your suggestions so that I can include them in the show. In future shows. And otherwise, thank you so much for being here today. Again, I hope this was educational and informational for you. And I hope you can take something out of this to help somebody else. In the meantime, have a great day. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.